Welcome back to the Mental Lift Podcast, where we explore the connection between mental wellness, physical health, and building stronger lives from the inside out. I'm your host, Karla Hutcherson, licensed professional counselor and certified personal trainer. And today I'm joined by my daughter-in-law, Dr. Laura Hutcherson. Dr. Hutcherson graduated from the University of Texas at Austin with a bachelor's degree in biomedical engineering before completing medical school at UT Southwestern Medical Center with an emphasis in research. She also completed a residency training there, specializing in obstetrics and gynecology. Today, we're diving into the evolution of hormone replacement therapy, how research and perspectives have changed over the years, and why more women are beginning to revisit conversations around hormone replacement, menopause, and overall wellness. This is such an important and timely conversation, and I'm so excited to share it with you. So let's get started. Welcome, Dr. Hutcherson. So no coincidence that our names are the same. She's married to my amazing son, Connor, and the mother of my beautiful granddaughter, Eliza. So, well, tell us a little bit about how you got in the field of women's health. Why did you choose that?
You know, when I went into medical school, I was very interested in surgery because, you know, you rotate through all of the different clinical rotations. And I was just so captivated, and especially with an engineering background, I really loved working with my hands and solving concrete problems. It just...
That engineering brain.
Yes, it just made, you know.
Did you do this as a child too? Like, were you one to be playing with all kinds of mechanical things and engineering kind of things?
Well, my mom always... says stories about you were 2 years old, 3 years old, fixing the VCR and figuring out the TV and all those kinds of things. I'm like, okay, Mom. But yes, I think I was very much a self-starter, independent. Yes, and I think my daughter Eliza has a little bit of that as well.
I would definitely say that she loves to take everything apart. We haven't got the putting it back together yet. She's getting there.
But women's health specifically. So I was looking at general surgery, urology, and OBGYN as well. And I thought it was so cool to have these vulnerable conversations and the public health aspect of it.
Yes.
Women's health, it's broad. I treat adolescents, teenagers. Mm-hmm. I treat women in their 20s with infertility. PCOS, which is now PMOS. I'm treating women who are having babies, women who can't have babies. I'm treating those that are entering menopause, perimenopause, with menopausal hormone therapy, those kind of things. So being able to work with women in all those vulnerable stages of life is very valuable and kind of why I went into it.
So it's great that that's an area of passion for you, because I think in more modern days we're drawing more attention to it, but it wasn't really paid attention to in the past. Sure. So I love that we are paying attention to that and giving women the opportunity to enjoy all areas of their life and all stages of their life. And I've said this before on my podcast, I feel better in my 50s than I did in my 30s. But I think that has a lot to do with healthcare, and just finding new ways to take care of myself. So what's it like being on a podcast with your mother-in-law?
No, it's great. It's fun. I did, like I said, I did my homework, so I listened to the last couple episodes you've had, and I mean, I think it's inspirational what you're doing. It's what we have similar jobs in a lot of ways. We do one-on-one trying to help, you men and women, me, women, work on themselves physically, mentally, give them the tools. We have 100%. Very similar jobs, so I think this is awesome what you're doing.
I do, and I know that we cross paths. You're referring to me. I'm telling people, especially the women who are coming in here, and they need help, and so I'm sending them that direction as well, because a lot of people don't understand the value of having that really close relationship with your OBGYN and how much that can really be life-changing in a lot of ways. So I think that's super important. As we get into hormone replacement therapy, and I don't want to make that the only topic we cover today, because I think there's so many other areas we can talk about, and we'll get into that as we go. But I think it's something that's in the news, on social media, it's everywhere. I mean, everyone's talking about it. And in my own experience, there were so many things in my life that weren't going well, even though I was doing the eating right and I was exercising and I was doing all the things everyone tells me. I was just at this plateau and I couldn't get past it. And it wasn't until I discovered hormone replacement therapy that everything changed. So I think it's going to be a great topic to kind of start with. But can you tell people what hormone replacement therapy is? Like, what is it all about?
It's a nuance, but a lot of times when we're talking about hormone replacement therapy, in the academic medical world, it's menopausal hormone therapy, which means supplementing estrogen and progesterone, typically is what we're talking about. And also testosterone has become definitely much more in the zeitgeist. But if we go back a little bit to explain why this is even a topic. So women are unique, and we are born with all the eggs we will ever have. Your egg quality and quantity decreases with age until you reach the age of menopause. And what is menopause? It's when you run out of estrogen. It's when you run out of eggs. That time before menopause, it can be up to 10 years for some women, and that's called that perimenopause period.
Okay.
And that's when you have those huge fluctuations because you're sputtering out those last few eggs, and so you have abnormal bleeding, and you have those huge hormonal shifts, and you start to feel very off and not like yourself and have a lot of these symptoms I'm sure we'll talk about soon.
Yes.
And then that menopause is when you've gone 12 months without a period, and then after that is postmenopause. And that's when you have no estrogen. And so when we talk about hormone replacement therapy or menopausal hormone therapy, we are replacing or supplementing that estrogen, testosterone, progesterone that your body is no longer producing.
Yeah. And I'm glad that you kind of gave the difference between perimenopause and menopause, because I don't know that people, they use those terms interchangeably, and I don't know that they're using them correctly. And so I think that that's a really good point to make. It was so controversial in the past, hormones, and they were only giving you the least amount of estrogen, which almost didn't make much difference. What was the fears around that? What were people thinking back, 20, 30 years ago, and why weren't they on board with hormone replacements?
So a recent statistic I found out was about 27% of menopausal women in 1999 were on hormones. That changed in 2020 to about 5%. So from 27 to 5% of menopausal women. That's a huge dip. I'm not exactly sure what the statistic is today, but I would imagine it's significantly increased.
Yeah.
And we have to look at the history of hormones. And, when they came on the market, there was FDA approval, and so OBGYNs were okay, felt comfortable with prescribing them. The WHI trial, that was the Women's Health Initiative, that was in 2002. They studied women. The average age was about 63, so it's about 12 years beyond the average age of menopause in the U.S., which is typically about 51. And they compared women for 5 years who were on hormones, and these were synthetic hormones. The brand names would be Premarin and Provera, different than the hormones we give now. They compared those to women not taking any hormones. They followed them for 5 years. They actually stopped the study early saying, oh no, this causes breast cancer. Oh no, this causes stroke. We have to stop, pull everything off the market. In 2003 is when the FDA put the black box warning on estrogen-containing products. Well, fast forward, we've looked at that data. We've followed these women for 20 years, and we have found that, in fact, if you start hormones within the 10 years of menopause or under the age of 60, it decreases your all-cause mortality by 30 to 50%.
Wow.
And also decreases your cardiovascular risk by about 30 to 50%.
That's huge.
And no change, so they followed those women 20 years, no change in all-cause mortality related to breast cancer.
Wow.
So the FDA, as of July of this past year, had a panel where orthopedic surgeons, urologists, OBGYNs all came together and demonstrated through data, through looking at the trial again, explaining, that they look at the statistics incorrectly. The women were much older. It was synthetic hormones, very different from what we're doing today.
And I was going to ask about that, the synthetic versus they're more natural now, or how are they, what is the change in the hormones?
So before what they were giving was conjugated equine estrogen, and that's from horses. equine.
Okay.
And then the progesterone
Didn't know that.
was medroxyprogesterone acetate, which we still prescribe sometimes to premenopausal women, but we don't typically use that as hormone replacement therapy. Typically, if you were to see me in my clinic, what we're using now would be estradiol. So it's bioidentical. You'll hear that word a lot.
Yes.
So it's much more similar to what your body would naturally be producing if you were born with more eggs, and you didn't stop producing you didn't run out of eggs by the age of 51. And then the progesterone we use is micronized progesterone. So again, it mimics the natural progesterone you have in your body. So just real quick recap about the FDA. So the FDA panel was back in July, and as of November, just a couple months ago, November 2025, they took off the black box warning on estrogen.
That's wonderful.
And I mean, they followed the evidence, and now they say that they recommend it within 10 years of menopause or before the age of 60. Beyond that's kind of a nuanced conversation with your healthcare provider. But that was a huge landmark that women are flying to their OBGYNs.
Oh, 100%. Sign me up.
It's hard to get estrogen patches now. Yeah, I have a lot of patients calling around different pharmacies because they can't get the estrogen patches. They're so popular.
Yes. What's the importance of having the estrogen with the progesterone? Because I know that when I was getting mine, they were saying at a certain point you don't need the progesterone.
If you have a uterus, and you're on estrogen, you have to also be on progesterone to protect your uterus. Because if you think about, kind of going back to science class, everything in your body works together. So your brain produces hormones, FSH and LH. What are hormones? They're simply signaling molecules. They signal your adrenal glands, they signal your gonads, so your ovaries, to produce estrogen every month. And that's why you have a period every single month. Progesterone, when you ovulate, you leave behind a corpus luteum cyst. That corpus luteum produces progesterone. And when you don't have a pregnancy, the corpus luteum involutes, and that progesterone withdrawal, that's what produces a period. And so that's what happens every single month. Estrogen is the fertilizer of the grass of what I call your endometrium, which is the lining of your uterus, and progesterone, that's the lawnmower. So that's why whenever you have a uterus and we're giving you that fertilizer, we're giving you estrogen, we have to balance it out with progesterone to thin the lining of the uterus, protect your uterus. We have to bring that lawnmower so we can make sure that we're doing it safely. You don't develop precancer or cancerous cells inside your uterus from unopposed estrogen.
So someone who's had a full hysterectomy probably wouldn't need that, or would you still recommend putting both together?
It depends. Sometimes progesterone is not necessary if you've had a total hysterectomy, total meaning your uterus and your cervix has been removed. But a lot of my patients do want to be on progesterone. Micronized progesterone at night works on the GABA receptors in your brain and actually can help with sleep. It can help with insomnia, which is very common in perimenopause.
Yes, I was going to say that's a great, and that brings it to kind of what I wanted to talk about now is what are things that hormone therapy can actually improve?
When my patients, a lot of times, this could be late 30s, early 40s, late 40s, coming in, a lot of times the first symptom is, I don't feel like myself. But it's not always hot flashes, vaginal dryness. Those are the most typical symptoms you hear that perhaps your hormones are off or you're getting into that perimenopause state. But also physical exhaustion, sleep problems, difficulty falling asleep, irritability, mood swings, that's a huge one, anxiety. So a lot of times, what are we doing? We're putting them on a medication to help with their depression, anxiety. We're putting them on a medication to help them sleep. We're putting them, we're just packing on medications when really it's their hormones. You're not feeling your best. You're not sleeping because your hormones aren't there. So
it's a good place to start. When someone comes in and they're experiencing depression, anxiety in your office, that's a good place to start is kind of checking their hormone levels.
Exactly.
Yeah. That's awesome. What about this brain fog? I mean, I hear people talking about that. What does that look like? Maybe I've had it. I'm not sure.
That is definitely another symptom that many patients come in with. And I have had patients, I've started on hormones, and they tell me my colleagues are saying something is just not right. You're a little bit different. You're not yourself. And we put them on menopausal hormone therapy, and they come back and they say, I feel so much better. I feel more like myself. My colleagues have noticed that I am much more with it. I am not as irritable,
All of this is my husband noticed.
Yes, but anyways, that's also one of the, sweating, hair loss, feeling cold, headaches, weight problems, bladder problems, those kind of things.
And that's, our paths cross so much here, because when women are coming in and they're describing those things to me, they're in tears. I mean, I have women in tears in my office. I mean, that's what I'm telling them. Very first thing. And, I have good relationships with psychiatrists, and I believe in the things that they do. And when you have a really good psychiatrist, that can be very, very helpful in getting your brain back to where it needs to be and help with those things. But at the same time, it's so important, and I have my patients start with that. Go to your OBGYN and get your hormones tested, because that's a great place to start. And then the psychiatrists can do their part if they need to adjust after that. So it's a really good situation. And that's why, one of the main reasons I really wanted to bring you on is because I want people to understand. I want women to really understand, get the counseling, and have that relationship with their OBGYN, because I think those two things are so important in getting us in the healthiest state we can be at each stage.
And if you feel you can't have that conversation with your OBGYN, perhaps you need to find someone that you can have that talk with. I'll be honest with you, my training, my OBGYN residency, it's a lot of delivering babies, it's a lot of surgical technique, hysterectomies, it's not a lot of hormone care. Mm-hmm. So a lot of what I've learned is self-taught, learning from my patients, hearing from them, hearing from their symptoms, those kind of things. So I just want to put that little
and that's true. And I would say that's the case with any doctor, any therapist. You have to have that really good relationship. And I think people feel guilty if they go to a doctor and they don't feel connected, and they keep going because they feel guilty. And I'm like, don't feel guilty. This is your health care. Make sure you have the people on your team.
Advocate for yourself.
100%. And I think that's super important. And I always tell, if I have a patient come in and it's not clicking, I'm like, that's great. Let's find you someone that you click with, right? Because it's so important for them to be able to trust that person. And so that's super important. What are some different forms of hormone therapy? I know people talk about different forms. I mean, they come in different ways. You've talked about the patch just a second ago. I know they come in the pellets, if you may want to describe that a little bit, or they have Troches or whatever those things are. I don't know if I say that correctly, but there's different ways that you can get the hormones. So tell us a little bit about that.
So talking about systemic therapy, so where you're getting it through every cell of your body, essentially. And side note, there are estrogen receptors all over your body, which is why you have those whole range of symptoms, including joint stiffness and the importance also of hormones on your muscles and bones. When it comes to estrogen, there are multiple different forms. So when we're talking systemic, you could do an estrogen patch, an estrogen pill. There's also estrogen creams as well that you can put on your thigh or something like that. When it comes to progesterone, typically I find the best way to absorb that progesterone is by taking a pill. There are other forms, but it's really hard to get enough progesterone to really protect your uterus without the pill form. But some people do have an IUD, and that is a way to protect your uterus as well. When it comes to testosterone is notoriously difficult to measure and notoriously difficult to maintain steady levels in women's bodies. But the options for that, there are injections, there's a cream, there's the troche where you dissolve it in your mouth, usually once or twice a day. There's also the pellet procedures, like you mentioned, and usually it's a procedure every 3 to 4 months. It goes in the subcutaneous tissue in your bottom, like your upper bottom, and you can do testosterone and estrogen therapy. And usually, if you have a uterus, you'll also supplement progesterone in some way, likely a pill at night. Okay.
I mean, so lots of options for however you're comfortable with getting those things, but, just being able to talk through all of that with your doctor. What are the benefits and risks? The pellets are somewhat, you call it a surgical procedure, but it's not surgical procedure, but it's kind of, you have to go into the office and all of that's replaced. So, for some people that's not ideal. So maybe some of these other forms work, but regardless, all of those things are effective, and you just have to find the one that really matches your lifestyle the best. I don't know, but with the patches or the creams, what about getting in water? Does that affect them?
The patches are waterproof. I typically you can do a weekly patch or you can do a semi-weekly patch. A lot of my patients like the semi-weekly patch for what you just mentioned, make sure that they're not starting to peel off after a week. But they are waterproof, so you can go swimming. You can kind of hide it under your bathing suit as well if you don't want to show off your patch. Although I think that'd be pretty cool. You could be patch sisters, And the cream absorbs into your skin, and so a lot of times I'll advise, if you're doing a testosterone cream, to do it in the inner thigh nightly before you go to bed. Oh, and I also wanted to mention vaginal estrogen cream, and vaginal estrogen cream is more for a local environment of estrogen for those who are suffering from vaginal dryness or pain with sex, dyspareunia, things like that.
Some of those other wonderful menopausal symptoms.
Yes.
There are so many. I mean, it's just so amazing how menopause affects. And you think about when you go through menopause, you still got like 30 or 40 years of life here left, or some of us are 50, right? So that's a good portion of your life. Don't be miserable.
Yes. And for some reason, someone said this to me, and I was like, oh, that really resonates. For some reason, our bodies were meant to have children when we're 15, 16. I mean, that's the ideal time in your fertility journey.
Right.
And then we go through menopause, average age 51, different based on your family history, based on, your race, things like that. And for some reason, we're not supposed to live past that age because our body loves estrogen. Everywhere in our body loves estrogen. Our bones love it. Our vaginal tissue loves it. And so for our bodies not to have that, it affects us cardiovascularly as well.
Yes, 100%. So we are not going to just say once we hit menopause, we're old ladies. We are not. We are vibrant, beautiful, wonderful women. And so we have so much life to live. I mean, there's just so much left to do. And so I hate that it gets the bad rap, right? And actually, it's kind of nice. There's nothing wrong with menopause. It's not a bad word. We'll take that right out of there. We've talked a little bit about it, but just the connection of mental health and women's health and how important that is. I'm putting the connection of mental health and physical health together so that women can feel better about themselves, because I feel like once we get all these menopausal symptoms, our confidence, our view of ourselves it sinks. And so what are you seeing in your office regarding mental health?
So mental health, obviously, is a lifelong battle. So, and I'm dealing with people all stages of life. So sometimes I talk to people who have a history of sexual assault, and that plays a big role in their dating journey and their fertility journey. That's another thing, is I see women who've had recurrent miscarriages or can't get pregnant, and days like Mother's Day are
really hard.
Very, very difficult. And then I also talk with women during their pregnancy, having a very difficult pregnancy, in and out of the hospital for bleeding or nausea or things like that. Or maybe this was an unexpected pregnancy and they don't have that support system around them. And then, as getting a little bit older, a lot of times in that perimenopause period, depression, irritability, gaining, that gut, that visceral fat, where you're saying, hey, I'm working out, I'm doing everything the same, but
it's a terrible thing.
Can't sleep and I can't lose the weight, and it really affects your mood and affects your confidence.
It affects your relationships, affects your marriage relationship,
right.
affects you getting out and being around people. I mean, there's so much that goes along with those changes in our body that affect our mental health so bad that it can affect the quality of our life.
And a lot of times let's make sure your thyroid's normal. What is stressful? Are you sleeping? Why is your cortisol so high? Your estrogen and testosterone are naturally decreasing with age. So what can we do about that? And if we kind of address those underlying issues, a lot of times we can help the issues of depression, irritability, insomnia, not really being able to sleep, the issues with your partner, not really wanting to have sex, low libido, or having vaginal dryness or discomfort with sex, or hey, let's talk about pelvic floor physical therapy. There are so many tools that we have to help women feel their very best.
I think it's super important that we've talked about so much about the hormone replacement therapy connection to mental health. There's so many other issues I want to dive into, but I do feel like, if our listeners are out there and they want more information, Laura, tell them about your office and where you're located so that they are able to reach out if they wanted to talk more about that.
Well, if you're in the DFW area, OBGYN North Dallas is where we're located. We work out of Presby Plano or Texas Health Plano, which is in West Plano, but we're also pretty close to Frisco, the Colony, North Dallas, things like that. And we offer full service OBGYN care from adolescence all the way to menopause. And there are multiple menopause specialists that can help you, talk to you on an individual level and see what your needs are and how we can help you.
And when you're working with patients and just kind of making that overall mental fitness connection, what's the importance of exercise and eating habits, and what kind of discussions do you have with your patients around those kinds of things?
Every single well woman exam, I ask, what are you eating? Are you sleeping? Are you exercising?
Yes. Because
that is the essential, that is the backbone, that is the foundation. Those silly phrases, you are what you eat. It's true. It's true.
Exactly.
So I always talk about Mediterranean diet. What does your plate look like? Half your plate, fruits, vegetables, the other half, whole grains, lean meats, chicken, fish, turkey. I try to give, I offer nutrition counseling. I offer a bariatric surgery team if that's, depending on their weight goals. So I try to meet my patients where they're at, but yes, that is the absolute foundation. And then a huge thing I do talk about is strength training.
Thank you. This is like my passion. And we think about osteoporosis and all these things, and people get so scared of lifting weights, but it's the best way to protect your bones.
Yes. I think we need to look at our moms and our grandmas, and we need to be thinking about longevity. Mm-hmm. So like you said, you hit menopause at 51. Well, you still got another 30 years. What do you want those years to look like? Do you want to be suffering cognitive decline, cardiovascular disease, Alzheimer's, having falls, breaking bones? Or do you want to be living your best self and feeling your best self?
Exactly.
And so one of the best ways you can do that, I tell every patient, is you need to be doing weight-bearing exercises. You need to be lifting weights, not just, trying to do cardio. It's not the 90s anymore. We can't just...
It's not just about going on a run, right?
Yes,
It's not just about that. And that's one of the main reasons I tie strength training into my mental health field, is because it's so important for our physical and our mental health. And it changes lives. And when you have a really good trainer, and this is something I focus on, I meet my clients where they are at, but I'm also going to challenge them. And, so we're going to start at a place where they're comfortable, but then we want to move out of comfortable, because that's where the growth happens. And so we really have to focus on that. Well, let's get into some things that you are really passionate about. Like, what are some health topics that women's health topics that you wish received more attention?
Well, I think hormones is a good start. And it's a very exciting time to practice now that patients are taking, they're advocating for their health and wanting to talk about hormones and wanting to know the benefits and things like that. A couple things little health tips I usually like to tell patients is, if you could get pregnant, make sure you're on a prenatal vitamin, because it's important to have folic acid stores before you get pregnant. And then in terms of perimenopause, abnormal bleeding should almost always be evaluated with your provider. Postmenopausal bleeding, so if you've gone 12 months without a period, having bleeding after that is never normal, and we definitely need to evaluate that.
So just being aware of your body and being aware of those changes, what's normal versus not normal. And if you have a question, it's always safer to ask. Mm-hmm. So do you think younger women are being more proactive about their health than maybe older generations?
Have you seen how many women with the aura ring?
The aura ring.
Yes.
Does the same thing as the watch?
It does a little more because I think it also tests your temperature and things like that. I'm no expert in it, but I probably should get one at some point. But it's definitely seems to be a staple of many women who come into my office have the Oura ring. And also the Dexcom has also become more popular. So you can continuously measure your glucose. So when you eat a cookie, you can see your glucose spike.
So there are people that just have diabetes. Is it just a diabetic thing, or are other people using it for other reasons?
I have a colleague and a staff member in my office. They both have Dexcoms and Oura rings because they're just that interested in their health and they want to see how everything relates. And I find that's fascinating.
That is fascinating.
Yeah.
I have not heard of that, so that's very interesting. So we may be seeing an uprise in in those glucose monitors. So.
I do think the next generation cares.
Yeah.
Understand.
Well, I sure hope so. I hope that as women, we're doing a good job of really promoting women's health care. Because you know what? If women aren't happy, no one's happy, to be honest with you, right? I mean, it kind of affects the mood of the whole home, doesn't it?
Mama's not happy, ain't nobody happy.
Yeah, nobody happy. No, that's exactly right. So it's really important. I just think, as women, we have sacrificed so much over the years when we are raising a family and we're working and we're doing all these things. We just don't put enough importance into ourselves, or previously it's looked at as selfish or self-centered, but it's just not. It's so important. You're doing your family, you're giving them a gift when you take care of yourself, because again, it makes the family healthier.
And there are periods where it is a little bit more difficult. So I mean, I do acknowledge that, a lot of my patients, they're going through a divorce. They're a single parent. I myself was in residency not that long ago and pregnant, and I didn't have a ton of extra time or energy.
Yeah, 100%.
So I do think there are periods we have to give ourselves a little bit of grace. But that's why I watched your Tawanda episode.
Yes.
And so wherever you can get it in, every little bit counts. So maybe you're not doing strength training 5 times a week in this stage of life, but
are you getting out and going for a walk?
Exactly.
Are you able to, when the babies are asleep, being able to put on a exercise video in your living room of some sort, but having just those little things, baby yoga, things of that nature. But, finding or taking advantage of the opportunities your corporations use. A lot of them have gyms, and, being able to take advantage of that, while you're at work, I think is super important. So what do you think so many women feel dismissed when discussing symptoms? They feel like it's just dismissed as not important.
I think that, again, goes to having the right provider where you feel comfortable. Mm-hmm. I think from a provider perspective, we have people all day long. We have a lot of patients. It's not a perfect system, but how insurance is set up, how we're set up for these 15-minute appointments, with a lot of anxiety, you're trying to provide a lot of reinsurance. Oh, that's normal. That's fine. That's normal. This, because you hear a lot of the same symptoms again and again. So I think sometimes we conflate what is normal, what is typical, and what is normal. So, for example, perimenopause. Oh, I'm depressed. I'm irritable. I'm gaining weight. Oh, that's normal. Oh, that happens in perimenopause. That's very typical. So acknowledging that, but I think the next step is important. That's part of advocating for yourself, to say, no, but what are we going to do about it?
Mm-hmm. Yeah, I'm not okay just accepting that that's normal. Right? Because I don't feel like myself, right? I mean, I don't want to be a size 10. I want to be the size 4 I always was, you know what I'm saying? So I think, maybe not dismissing and calling it normal so much, but just saying, okay, these are things that happen. What are your goals? What do you want to do with that? What would you like me to help you with?
And that takes a lot of self-reflection and so-called being selfish to kind of find that within yourself and, put yourself first in that way. Because like you said last time, if you're not healthy, if you're not taking care of yourself, you can't be the best mother and daughter and wife and even as good at your job if
100%.
you're not taking care of yourself.
I think so. There's just such an importance of confidence, women having confidence, because when we have confidence, we achieve our goals. When we don't have it, we stray away from them. And so I feel like it's so important to find ways to feel your best and to look your best so that you can be your best. I think is super important. So what should women advocate more strongly for during doctor's visits? Like, how should they handle those doctor visits?
I think if you do some self-reflection beforehand and kind of come up with a brief list and come in with those questions, those concrete questions for yourself, I think that is probably the best use of your time and their time. So you have it written down. You're not too scared to ask the question, and you can take advantage of both of your time.
I love that. What advancements in women's healthcare are you most excited about?
I'm very curious how testosterone is going to play out. It is not technically FDA approved, but it doesn't mean we aren't using it and finding benefits. And, we usually use about 1/10 of the dose that we give men. So I'm very interested in how that develops.
Me too. I'm very interested in that one. So I'm going to be asking lots of questions in the future about that.
Yes.
So yeah, I hear so many good things about it and have experienced good things with it. So I would love to see more about that.
And PCOS as well has just changed names. And so we're treating it now as a full body disease that's affecting your cardiovascular health, your insulin sensitivity, your predisposition for diabetes, things like that. So I think we are getting better at looking at women head to toe, not just, we need to protect your uterus, put you on birth control pills, but how does this affect your whole health? And so I'm really excited about that.
And all those initials, and just for those of us who are not so educated in that, what does that mean? Like, what is that disease? What does it mean?
Polycystic ovarian syndrome, typically 2 out of 3 of the Rotterdam criteria makes the diagnosis. One is irregular periods, a lot of times anovulatory cycles, meaning that you don't bleed for a couple months and then you have a very heavy period. So you're not ovulating every month. And that's often what leads to infertility. Another criteria would be androgen excess, so significant, cystic acne, abnormal hair growth that looks more man-like is typically how it's described, androgen excess. And then the third is polycystic ovaries on ultrasound. And so that's kind of where it got its name from, but people got a little too focused on the polycystic ovary part and not as much about how does all this androgen and estrogen excess affect your cardiovascular system, affect your insulin sensitivity, things like that. Because you do have a higher risk of metabolic syndrome with a lifelong disease like PCOS.
So what that just said to me something is, with the battles of infertility, is catching those things earlier, does that help decrease the rate of infertility?
We are finding, so the infertility rate seems to be on the rise, but I think there's also this confounding factor where women are
having babies later.
Mm-hmm. Exactly, which is fabulous that we can do that later. We have the technology to do that, that we can set up our careers and we have that flexibility and feel comfortable and confident to do so. But yes, it does seem to be harder to get pregnant. And so that's why it's so important to kind of, if you're having any problems, if you're not having a regular period, if you're having some of those symptoms I mentioned, to get checked out early and kind of work with your OBGYN, work with your endocrinologist, work with your primary care physician to kind of help come up with a solution. And a lot of times that solution is working on diet, exercise to help start ovulating regularly, because the menstrual cycle is actually one of your vital signs. It's a clue about your hormones and your overall health.
Yes, I agree with that. And so that's I don't know that people really put those pieces together, and I think that's super important. Well, thinking about generational questions, how do you think social media has changed women's health education? Is it better or worse?
I think overall better. However, I do have quite a few patients come in saying, on TikTok, they said that this was really painful. ChatGPT told me that,
Oh,
so
ChatGPT.
there are some influencers who don't really have the educational background. They're going off of their experience, and sometimes I do think that can be harmful. However, if you're gaining your information from influencers who are OBGYNs, who have gone through that residency training, who have all this experience, I think paying attention to that has huge benefit.
What advice would you give women who feel overwhelmed navigating conflicting health information online? I tell people don't go online for health information. I don't do the Google doctor thing.
Short answer, talk to your provider.
I agree. There's so much, I have people who come in and Google things and then they just create in their head that they have these certain things wrong with them. And I'm like, yeah, let's not do that. Let's just do an evaluation.
I mean, you know above anyone else that social media does harm you
100%.
mentally. It can
Very
harm you,
much.
that comparison. And so there's always a balance of using it for good information,
correct,
but also not overusing it where it can harm you.
I love using it to tell people to go see their doctor. I love that.
I actually saw an article recently that the neonatal death rate was starting to uptick because more and more parents were declining the vitamin K. And that is so important to protect baby's head from hemorrhage after, going through a pretty small canal.
Yeah.
And I have had more patients questioning those kind of things. And it is good to question and ask why, but I do think it's important to trust the data, trust the research, trust your providers who've done, I did 12 years of studying to get to this point.
Yes, super important.
So ultimately, I would encourage,
I mean, if you read something on social media or hear something on social media, great. It inspired you to ask a question, right? You take that information and ask a question with a professional rather than just taking it as advice. I think that's super important. What do you hope women take away from this episode?
Advocate for yourself.
Yes. I'm a big person. I just did a speech on advocating. So I just feel like we have to be our own self-advocate. We are the best. We know ourselves better than anybody else. And you have to remember that that's part of building that confidence and being in tune to yourself is really asking those questions and taking those things seriously and loving yourself enough to ask those questions. I think it's super important.
And I'm constantly checking in with myself, and I would encourage the listeners, my patients, to do the same. Is how am I doing physically? Or especially if you're feeling a little depressed, check in with yourself. How am I doing physically, mentally, spiritually? Am I doing all the things I know that I should be doing? Go take a walk.
I think that's good. And just having, and I've said that in other episodes, is having that accountability person in your life, whether it's your partner or whether it's a best friend or whether it's your personal trainer. Have someone keep you accountable because we stick with things more when we have that accountability. I think that's super important. Here's some rapid fire questions. Let's see. One women's health topic every woman should learn about.
Menstrual cycle.
Understand your own menstrual cycle. Most underrated health habit.
Water.
Yes, I agree. Water is super important. The more you drink, the better.
I know. I'm like, where's my water bottle?
Biggest misconception about menopause.
Hormones cause cancer.
Very true. One lab or value women should pay more attention to.
Thyroid.
I agree.
Vitamin D.
Vitamin D, that's an important one. You know where we got that is outside. Most common thing women apologize for they shouldn't.
Oh my gosh, everything. I was so tired of saying the same things over and over again. So I created something that I put in my patient rooms. It's called the OBGYN World According to Dr. Hutcherson. No such thing as being embarrassed. TMI does not exist. You're not crazy. Your feelings are valid. Number 3, please don't apologize for your thoughts or feelings. Sorry is reserved for wrongdoing. And this happened so many times that I wrote it in print. Because people say, oh, I'm really embarrassed. I didn't shave my legs. Well, you think your gynecologist cares? First of all, don't say sorry. Don't be embarrassed. And nothing is TMI.
Exactly. I love that. That is so important. Best stress management tip.
I wear scrubs all the time.
Be comfortable.
A smile.
A smile. I love it. I love it. One thing you wish every patient knew before coming to their appointment.
Relax.
Yes.
People are so anxious, you know. It raises, you know, the white coat hypertension. They come in, their heart's pounding. And I tell them, I'm not that scary. You can be comfortable.
You're not scary at all.
Yeah.
You're not scary. Your personal reset activity after a long day.
I've been getting very much into reformer Pilates.
I love that. Reformer Pilates, that's hard. That's some good stuff. All right. Well, I always have my guest bring a product that they want to promote. What do you have for us, Dr. Hutcherson, or AKA Laura?
Well, in true OBGYN fashion, if you ask any OBGYN what their birth control option is for themselves, I bet you most of them will say an intrauterine device, an IUD, because
she's bringing it with her. We have them here.
Yes, so if
they
you're
look kind of scary.
No, they're not scary. If you're watching the video, then you can see this is the device that we use to
implant them.
Yes, and they last a really long time. They're over 99% effective, and they solve a lot of problems. So talk to your healthcare provider about IUD.
Your IUD. So now, I think, do women think that when they have one of those, it's going to be harder to get pregnant when they take them out, or is it not that hard? Or
when you take out an IUD, technically you would be able to get pregnant right away.
Okay.
Sometimes we will talk about spacing it out a couple months after you've taken out the IUD to let your endometrium, which is the inner lining of the uterus, thicken. So it's optimal
for the baby,
for you to get pregnant. This
Perfect.
is also a common question I get about birth control pills. People are scared of the birth control pills. It will suppress your ovulation. That's how they work. And it may suppress your ovulation for some period of time after you stop them.
Right.
But we're not talking 1 year, 5 years, 10 years. It should not harm your overall fertility.
Awesome. Good information. Those are great questions for your healthcare provider. What gives you hope about the future of women's healthcare?
Having conversations like this. The FDA listening. The fact that a urologist, an orthopedic surgeon, an OBGYN sat in a room and talked about hormones.
It's amazing.
And talked about how, Oprah's talking about it. If Oprah's talking about it, then it's definitely in the zeitgeist, and women's health is at the forefront.
Of course, if Oprah's talking about it, we must be. We should all be talking about it. So good stuff. You've been such a blessing for our audience. I know that you answered a lot of questions, and I know there's so many more that may pop up. Is there a way people can reach out to you through, or your organization? Do you all have a way for people to ask questions? What would that look like?
Come see me in the office. If you call our office, OBGYN North Dallas.
That's perfect. I didn't know if your office had some kind of social media
site.
We
do have a social media, OBGYN North Dallas.
Okay. So you could look at them up there, but the best thing is just make an appointment and check them out. This has been such a fun conversation for me, being able to sit with such an expert and professional, but also one that I love and adore as my daughter-in-law. But today's conversation reminds us that women deserve healthcare conversations rooted in education, research, compassion, and empowerment, not fear. Hormones, mental health, physical wellness, and overall quality of life are all deeply connected, and the more informed women become, the stronger they can advocate for themselves. And as always, here on The Mental Lift, we build strong bodies and stronger minds. Until next time, keep lifting. The Mental Lift podcast is intended for informational, educational, and inspirational purposes only. The content shared on this podcast reflects the personal opinions and professional experiences of the host and guest and is not intended to replace professional, medical, mental health, or therapeutic advice. Although the host is a licensed mental health professional and certified fitness trainer, listening to this podcast does not establish a therapist-client, a counselor-client, or a trainer-client relationship. The information shared is not a substitute for individualized care from a qualified professional. Always seek the guidance of your physician, licensed mental health professional, and other qualified health professional regarding any questions you may have about your physical or mental health. If you or someone you know is experiencing a mental health crisis, emotional distress, or thoughts of suicide, please seek immediate help. You can call or text 988 to reach the 988 Suicide and Crisis Lifeline, which provides free and confidential support 24 hours a day in the United States. If you believe you are in immediate danger or need urgent assistance, please call 911 or go to the nearest emergency room. Support is available, and reaching out to a trusted professional, loved one, or crisis service can help ensure your safety and well-being. Thank you for listening to the Mental Lift podcast. If today's conversation encouraged you or inspired you or gave you something to process and think about, be sure to subscribe, share this episode on your platforms, share this episode with someone who needs a lift, or leave a review to help others find the show. Remember, real strength comes from training both the mind and the body. Until next time, keep building strong bodies and keep building stronger minds.